for a loved one that is sick or at end of life is difficult emotionally and physically for both the ill and the caregiver. Often advanced care planning is not discussed, especially among Hispanics. During National Minority Health Month, a local nonprofit is providing the community information in Spanish to help them prepare for these conversations and to make the right decisions about serious and critical health issues. Joining us now is Maria Pepe, Hispanic Community Partnership Specialist with Empath Health. Welcome to Blue, Maria.
Thank you, Gail.
Such an important subject. You know, it's not one that a lot of people want to think about or talk about because you don't want to think about your end of life. However, it's so important, not only for yourself, but for the people who care about you and that are there to take care of you.
Yes, and sometimes we don't think so much as our role of care receivers as we think of who will be caring for our parents or our elderly. But it's important to start these conversations because we need to start also thinking about what's important to us. If we are ever in a situation where we're incapacitated, unable to communicate our choices.
And why is this message so important to get out to the Hispanic community especially?
A lot of these choices are new concepts, including living wills, selecting a healthcare surrogate. These are new concepts for a lot of Hispanics, Latinos living in the United States. So first we have to introduce the concept of this documentation and the possibility they have of having control in having a say of what will happen, or these are my wishes if I was ever in this situation. But also we tend to avoid having these conversations. I don't know if it's a cultural thing, but you know, we do everything we can to steer away. No matter how important these conversations are, we try everything we can to avoid them.
Now, talk to me about this. I know, like, I come from a very Italian family, and in an Italian family, we all jump in as family to care for one another. Like, we're there for each other, and I would imagine the same holds true in the Hispanic population, where you really rely a lot on your family. So when you have these conversations and you map this out, it really can help the people that are there, that love you, that want to take care of you, do the right thing.
And it will prevent family conflict and discord. It relieves the anxiety if your caregivers, your family, those people who are important in your life have a clue of what was that you will have chosen for yourself. And the role of the caregiver already has so many components. Understanding the healthcare system is complicated. Seeing our loved ones fade away through an illness or due to injuries is also very stressful, very frustrating. It's a very sad moment. So if on top of that we add uncertainty because we never had this conversation, it is very devastating for families.
Absolutely. So tell me more about what Empath Health is doing specifically to help. I mean, what does the campaign look like? How are they reaching out?
Well, we always have programs like Choices for Care, where we sit down with families, certified facilitators like myself and many people in my team, to have these conversations early on. Why to wait for end of life? Let's have the conversation now. But recently, we just partnered with Penn State College of Medicine, University of Kentucky, and the Hospice Foundation of America, and we are conducting researches and having conversations in groups and see the result of different modalities, because there is no wrong or right when it comes to end-of-life medical choices. What is important is that people are having the conversation.
And it's interesting, and we don't have much more time to talk about a minute, but I love that you're working alongside hospice as well, because there's been so many studies that show that when you bring in hospice a little bit earlier, maybe not so at the end of life, you know, it's a much more comfortable path to end of life, not just for the patient, but for the family and the people that love them. And they take a lot of stress out of the equation.
Yes. Hospice is family-centered. And we know that our hospice clinical social workers and nurses will be facilitating a lot of these conversations about choices and medical decisions with the family and their caregivers. So they are a great support for us. We rely a lot on their expertise and their experiences with different families, different backgrounds, so we can implement those in the education that we provide for much early in life. So everybody can have their plan, and these plans are revocable. I mean, people can update them as they age.
Very interesting. Thank you so much for joining us. We really appreciate it.
Thank you so much.
And for more information, you can head to WFLA.com/Bloom, and we'll be back with more Bloom right after this.